Welcome back. Joining us virtually today for our COVID-19 coverage is Dr. Lawrence Seymour. Good afternoon. Thank you so much for joining us virtually today.
Thank you, Taylor. It's my pleasure to be here.
So, Dr. Seymour, what is the biggest question you see patients ask regarding the Delta variant?
The biggest question they ask about the Delta variant that I've seen is it for real? In a very sort of just basic sense. Is it for real? And the answer is yes. It is much more contagious and much more severe than the original COVID. The second question, Taylor, they ask is, do the vaccines still work? And the answer to that one is yes. The vaccines still give you very good protection against Delta, both against getting it and against dying from it.
Yeah, and so that kind of follows into my next question. We see these people post on social media all the time saying they know someone who did get the vaccine, but that person still got COVID. So what do you want people to know when it comes to the COVID-19 vaccine?
Taylor, that's a great question. And I have some personal experience with that as well, as a really good friend of mine recently contracted the Delta variant after having the Moderna vaccine a couple of months ago. The main thing to bring home about the Delta variant and the vaccines is they still do give you good protection. There are two different things. The Pfizer vaccines in that area tell us that the vaccines are around 60 to 70% effective at preventing any infection from Delta. Okay, so preventing a positive test, preventing symptoms. However, 30 to 40% will still get symptoms, but the key thing is that the vaccines then protect you from a severe course. So they're 95% or so effective at preventing serious illness and death from Delta. And if you're unvaccinated, much higher chance of ending up in the hospital or, God forbid, dying from COVID if you get the Delta variant.
And you mentioned hospitalization. So we are seeing those increase in the state today. LDH saying that there's 779 people in the state currently hospitalized with COVID. So are you seeing more of these patients that are unvaccinated hospitalized?
Yes, there's a direct correlation between the number of COVID infections that are rising in various parishes in Louisiana and the rates of vaccination. Lower vaccination, more infections. It's just that simple. And most people that are presenting to the hospital with COVID infections have not been vaccinated.
Absolutely. And so if there's someone at home that is watching this right now and they're on the fence about getting the vaccine, what do you want to tell them?
What I want to tell them is I get it. I understand the fear. I understand the hesitancy. There's a lot of questions about there. What I want to assure them is that rapid approval of medications is not anything new. We've been doing it for a while with medications for cancer and HIV and conditions like that. So rapid approval does not mean that something isn't safe. It is normal to continue to study medicines and vaccines for years to look for rare and rare events. These vaccines are very safe, and more importantly, despite all of the different side effects you've read, you are more likely to get COVID and die from COVID than you are to have any of the reactions that the vaccines have been associated with. They're all so rare, it's insane. So please think about getting the vaccine and talk to your doctor if you have any questions about it, if you're worried about risk factors. So that's my take-home message is please don't be afraid of the vaccines. I get it, but for our protection, for your protection, please talk to your doctor about getting one.
Absolutely. Dr. Seymour, thank you so much for joining us virtually today to answer some of these really pressing questions that people might have about the Delta variant. Thank you.
Have a great day.
You as well. If you at home want to rewatch this interview, it's going to be on our website, klaf.com, along with all of our other COVID-19 vaccine information. You can find it all on our website. Before we go to break, let's send it on over to Corey Smith.